Cape Town is 7,300 miles from Auckland, New Zealand, and everybody in your game is focused today on New Zealand, where they actually announced a plan to quote unquote open up New Zealand. How far are we from other nations saying enough, we're done, we're going to open up? When does America, when does the United Kingdom or France, name the country, when do they do a New Zealand?
Well, I think in this region, and as you said, I'm here in South Africa today, we lifted more restrictions in South Africa. We're seeing, I think, a number of countries, Botswana, Malawi, Zimbabwe, around South Africa, also in this post-Omicron, post-Delta position where so many people have had the virus. Vaccine coverage is low, but nevertheless, we're really coming out on the other side. So I think in this region, you're going to see more restrictions lifted. Remember, too, this is a really young part of the world. So Malawi, for example, the median age is 18.
Wow.
They should never close schools again. It's just, that is not going to happen, and it shouldn't happen. We're different in the U.S. We knew there was going to be a lag. We knew there were going to be this hospitalization wave. We knew there was going to be this loss of life. And we had, yesterday, 3,600 deaths. So we're not out of it yet. And we still don't have high enough immunization rates. And we still don't have high enough boosters, particularly for people over age 65. So that's a big part of the reason why we're not there yet.
How do you respond to the regional nature of the recovery in the United States? How does a pro develop Northeast, Midwest, South, Far West, all the different regions you people are expert on? How do you adapt to that into March and into July?
Well, I think you're going to see that the declines in the places that had Omicron first, like the Northeast, New York, New Jersey, Connecticut, are going to continue to go down in terms of new cases. We're still in parts of the country where Omicron continues to surge, and the hospitalizations and the loss of life are going to follow that in the same lag fashion. I do think that we will, as a country, be in a very different position, certainly by the end of February, early March, because if, barring another variant with even more transmissibility or immune escape than Omicron, we will be coming out on the other side of all of those regional spikes. And I think, as we've seen before, and hopefully we'll see again, the warm weather is going to change the dynamic as well. And of course, we now have some other big changes. Moderna got full approval for their mRNA vaccine. Novavax has applied for emergency use authorization for their protein subunit, over 90% efficacy. And of course, we now have applications to the FDA for the under fives. Yeah. So all of those are going to matter.
Dr. Beyrer, can you game out what's going to happen as we kick off the Olympics tomorrow in a nation that really doesn't have a collective immunity and that is trying to make inroads with respect to new vaccination cycles, but has not really reached critical mass yet?
Yeah. Well, when you contrast, for example, what's happening in this region where there never was high enough vaccine coverage, but where there was so much more transmission, so many more people got infected, and these are young populations, China looks terribly vulnerable. Because they went with this zero COVID approach, and because their initial vaccines, the Sinovac and Sinopharm, turned out to be low efficacy against the new variants, Delta and Omicron, they're really not protected. And so despite their very strict approaches and control and intense surveillance, what they have is an enormous number of people who are vulnerable to this virus. And that now looks like a vulnerability, particularly as the Olympics get going.